Hello everyone, I'm Dr. Nishant Gupta and I would be teaching you extraction of teeth in orthodontics. Extractions is one of the most important methods of gaining space and in treatment planning in orthodontics. In orthodontic establishment of normal functional occlusion and balance, supporting structures occasionally requires reduction of one or more teeth. Most extractions are performed as part of a general plan of the treatment, which also involves the use of an orthodontic appliance. So how do we decide whether we require extractions or not? So the basic most common method uses arch length versus tooth material discrepancy. When the tooth material is greater than arch length, it leads to crowding and proclination. So either we can increase the arch length, that is through expansion, or by reducing the tooth material. Reducing the tooth material in a non-growing patient is the most important method of gaining space. So if the space is less than 4 mm of discrepancy, we can use methods of methods of gaining space like proximal stripping and expansion. If we have a discrepancy of 5 to 9 millimeters, we can decide either extractions or non-extraction depending on the patient's profile and other issues. If the discrepancy is greater than 9 mm in any of the arches, then extraction is almost always required. Second method where we require extractions is when we have to correct the sagittal interarch relationship. Extraction of teeth helps in the development of dental arches and the alveolar process. Thus, extraction of certain teeth in class 2 and class 3 malocclusion improves the abnormal sagittal mal relationship. In most class 2 cases with abnormal upper proclination, it is advisable to extract upper first or second premolars depending on the amount of retraction which we require in the maxillary incisor and canine region. However, when the lower incisor is also crowded or molars are not in full cusp class 2, it might be preferable to extract in the lower arch as well along with the upper arch. In classic cases are usually treated with extraction only in the lower arch. The most common extraction required in the class 3 malocclusion is the lower anterior extraction. There are different extraction procedures which are followed in orthodontics. One is balancing extractions, compensating extractions, enforced extractions, Wilkinson extractions, and therapeutic extractions. So what is a balancing extraction? Balancing extraction may be defined as the removal of a tooth on the opposite side of the same arch, although not necessarily the antemere, in order to preserve symmetry. Compensating extractions are where the removal of the equivalent tooth in the opposite arch is done in order to maintain the buccal occlusion. Compensating extraction preserve inter-arch relationship by allowing the posterior teeth to drift forward together. Example are third molar extractions, where if we have to extract one of the third molars, generally the opposite third molar is also extracted as there is no occlusal contact between the opposite teeth. Then comes enforced extractions. Enforced extractions are those extractions which are carried out basically because of either the tooth is grossly decayed or is of poor periodontal health, it is fractured or it is impacted. In such cases, we are forced to extract such teeth during the orthodontic treatment. Then comes Wilkinson extraction, one of the most controversial form of extractions. Wilkinson advocated the extraction of all first permanent molars in between the age of 8 to 9 years. The basis which he said of this extraction is the fact that first molars are highly susceptible to caries. The other benefits of extracting first molars at an early age are to avoid third molar impactions by providing additional space for the eruption, to reduce the crowding in the arch. Then there comes a therapeutic extraction. These are carried out for the purpose of the orthodontic treatment. So choice of teeth for extraction. There are multiple factors according to which we decide which tooth to be extracted. It depends on the direction and amount of jaw growth, discrepancy between the size of dental arches and the basal arches, state of soundness, position and eruption of the teeth, facial profile, degree of dentoalveolar prognathism, age of the patient and the state of the dentition as a whole. First, let us talk about incisor extractions. The incisor, especially the maxillary central incisor, are rarely extracted as part of the orthodontic therapy. Indications of maxillary central incisors are generally when they are unfavorably impacted, where they cannot be brought about into the normal occlusion, when they are buccally or lingually blocked out, lateral incisors with good contact with central incisors and canines, when they are grossly carious and grossly decayed, or when there is irreparable trauma to the concerned central incisor. Mandible incisors are generally extracted when one incisor is completely blocked out and it is not completely, it cannot be brought about in the occlusion and all the other teeth are in good proximal contact with each other, or when it is severely malpositioned Poor prognosis, as in case of trauma, carries bone loss. In mild class 3 incisor relation with an acceptable upper arch and lower incisor crowding, and when there is a bolted anterior axis in the mandibular arch of greater than 4 millimeters. Canines. The permanent canines are important teeth and are not frequently extracted as a part of orthodontic treatment. Their extraction are generally causes flattening of the face, altered facial balance, and change in the facial expression. So when do we extract the canines? Extracted only in those cases where it is difficult to align, when they are unfavorably impacted, when the apex is severely malpositioned and cannot be brought about, when they can cause damage to the adjacent tooth, or they are completely excluded from the arch. First premolars. First premolars are the most commonly extracted tooth in the orthodontic treatment therapy. It is positioned. Why do we extract the first premolars? The reasons are it is positioned near the center of each quadrant of the arch and is therefore near the side of the crowding. That is, the space gained by their extraction can be utilized for correction both in the anterior as well as the posterior region. First premolar extraction is the least likely to upset molar occlusion and is best alternative to maintain vertical dimension. The contact between the canine and second premolar is quite satisfactory, whereas the contact between the first premolar and molar is quite dicey. First premolar extraction leaves behind a posterior segment that offers adequate anchorage for the retraction of front teeth. What are the indications of first premolar extractions? Tooth of choice for extraction to really moderate to severe anterior crowding in both the arches. In lower arch crowding where canines are mesially inclined, spontaneous improvement in incisor alignment is generally followed by the extraction of first premolars. Second indication is correction of moderate to severe anterior proclination, as in class 2 dip 1 or class 1 bimaxillary protrusions. In high anchorage cases where we need to preserve the anchorage in the posterior region and as part of the serial extraction procedure. So when do we extract? The first premolars should not be extracted until all premolars, permanent incisors and canines have erupted sufficiently for brackets to be placed on them, as unfavorable impaction of any of the tooth can lead to loss of multiple number of teeth. So now we come to second premolar extractions. What are the indications for second premolar extractions? When second premolar is completely excluded from the arch following forward drift for the first molars after early loss of the descendant second molars, when they are unfavorably impacted, when the second premolar extraction is preferred in mild anterior crowding cases, as in space closure and vertical control is easier after anterior alignment. Second premolar extraction is preferred when one wishes to maintain soft tissue profile and aesthetics of the patient, when they are grossly carious or periodontally compromised. In open bite cases, second premolar is preferred for extraction as it encourages deepening of the bite, thus overall correcting the anterior open bite. First molar extraction. These molars are generally considered untouchable and should not be extracted unless, as advocated by the Wilkinson extraction, which is hardly a form of extraction which is followed in orthodontics. Extraction of first molar is avoided. Why do we avoid the first molar extraction? As it does not give adequate space to relieve anterior crowding, which is generally the common cause of patients approaching the orthodontist for the treatment. It causes deepening of the bite. There is a poor proximal contact between the second premolar and the second molar, which will be followed after the first molar extractions. Second premolar and second molar may tip into the extraction space, thus creating a food impaction area, and it also affects the mastication. So when do we extract the first molars? When they are grossly decayed or periodontally compromised molars with a very poor prognosis, when they are impacted. Second molar. Second molar is positioned at the end of the dental arch and therefore is away from the site of the crowding. Its extraction does not help in relieving the crowding. However, extraction may be indicated in the following cases. So, second molar extraction is generally done to relieve impaction of the mandibular third molar in certain favorable cases when they are severely carious, or ectopically erupted, or very severely rotated. In open bite cases, extraction helps in correction of the anterior open bite. Third molars extraction. Extraction of third molar during orthodontic treatment does not yield space for decrowding or reduction of proclination. However, they are quite commonly extracted in the orthodontic treatment. Indications are when they are impacted. The conventional timing of extraction of third molar is when 2/3 of its root is formed, when they are malformed, and when the molars are impacted in such a way that when they are erupting, they might directly forces onto the second molars and making them carious, or they might cause anti-crowding post-orthodontic treatment. Thank you.